District Media Group President Beverly Hallberg, Endeavor Strategies President and political commentator Kurt Bardella, and CNN political commentator and Democratic strategist Hillary Rosen. Kurt, you used to work with Republican California Representative Darrell Issa, who voted for the bill. His district went to Hillary Clinton by 7% in the election. Are you surprised by the way he voted?
I wasn't surprised by the way he voted, just because, again, for many Republicans, not just Congressman Issa, but many Republicans who are on the record 40, 50 times voting to repeal and replace Obamacare, they've kind of been boxed in by their own rhetoric over the last 6 years that they really have to vote for this in some way. Now, I think it was a terrible decision. I wouldn't have recommended it. I think that we also saw for so long Republicans really attack Nancy Pelosi and congressional Democrats for, quote-unquote, voting for a bill before knowing what was in it. And here they turn around and do the exact same thing. I mean, the real dangerous.
So you think they were hypocritical?
They're incredibly hypocritical. I mean, again, they don't know what's in the bill. Nobody talking about this bill who voted for it can actually sit there and look their constituents in the eyes and tell them how it will impact their health care. And that is the exact opposite of what our policymakers are supposed to be doing. One of the real big challenges here is, aside from just pre-existing conditions, the first pass at this, the CBO said 24 million people will be without health care because of this. There are so many more people impacted by this, just normal, healthy American families who right now we can't tell them what this plan will mean for them, what this plan will mean for their costs, what this plan will mean for the quality of care that they get. And the fact that Republicans were so willing to vote for something without being able to answer that question is unconscionable and incredibly politically stupid as well.
And let's remember now, the Senate is going to take up this bill. They say it's going to be weeks before they have any action, probably, that they take on the issue of health care. In fact, they do want to craft their own, and they're waiting on that CBO score in which we will learn exactly the cost of this plan and who and how people are going to be affected. I do think it's important to note, too, Beverly, Kurt, and Hillary, our thanks to all of you for coming on as we look forward to how this unfolds. We are going to be talking about more on definitively how people with pre-existing conditions are impacted, as I know that is such a huge issue, as well as the Medicaid. And so those voices and those issues will come out as we wash through this situation. Now,